Welcome to the Headache Doctor Podcast, where it's our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication, allowing you to thrive in everything you do. Hello and welcome to the Headache Doctor Podcast, where it's our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. In today's podcast, one of the most common questions that we get, whether it's people reaching out on social media in response to something they've heard on this podcast, or even especially in clinic, when we're going through an evaluation process or someone wanting to share what we're doing with a friend or family member, one of the most common questions we get is, well, will it work for them? Or what type of headache or migraine should I look for to know if that person's going to be a good fit? So I want to answer that today. The question of who is this actually for? This will be extremely relevant for you, the listener, because one of the deep burning questions that everyone with headaches or migraines has is what is the solution for me in my scenario? And especially when you hear amazing stories from people that have tried something, whatever it may be, and it's worked, you want to know, will that work for me? And there's a level of skepticism that's there initially. And the skepticism is there because you've tried product after product, medication after medication, treatment after treatment, and you haven't found the results you're looking for. And then the other thing that's in the back of people's minds is headaches and migraines are multifactorial. There's so many different things that can impact someone's situation that it does seem appropriate to assume or approach the next treatments with a level of caution to say that my scenario is different than someone else's. But when someone asks this question of who is this actually for, what is this treatment actually for, it's important to understand that in my world, and I get very excited about what I do because we help so many people with so many different types of headaches and migraines. And it's just this massively overlooked problem that people have, and they're not receiving the treatment they need. So I get very excited about the answer to this question because it can be a very sort of shocking response in a sense, okay? So if someone were to say, who is this treatment actually for? What I would say is anyone with head or facial pain. Okay, anyone with head or facial pain. Now, what does that mean? And let me explain in 3 different steps how I got to that, all right? I'll start off with a story, my own personal journey, because 7-8 years ago, I would not have thought that the approach of working on the neck and seeing this underlying neck problem would lead me to saying something like anyone with head or facial pain. And then I also want to talk about what that means to make a blanketed statement like that, anyone with head or facial pain. I want you to understand if that's you, all right? One of the things that I have a barrier with in regards to, well, one, I thought when opening up Novera that the stories that would come out of here would be enough to really just drive this demand of the product and what we're doing. And to my surprise, one thing that happened is the stories were there. People's lives were changed early on, but when they would share their stories, they would have a hard time getting people to believe that it would work for them as well. And so that barrier was a little bit of a surprise to me because my assumption was that when someone heard that their friend who had a personal story of having decades worth of migraine symptoms, tried every medication under the sun, nothing worked, went to this physical therapy specialty practice that was able to help them, that would be enough to convince someone to try it. But I've learned that in the headache and migraine world, People have tried so many different things that there is that level of skepticism. On the other side of that, we don't necessarily have 100% success rate, but we have a very high success rate. We have about an 85% success rate, which means that 8 plus out of 10 people that come to see us will achieve 80 to 90% relief. All right, so think of where you are now. Let's say you have 2 to 3 migraines a week. By the time you're done with our process, our goal is to get you to maybe a headache once a month, okay? And you're able to manage that on your own through self-management techniques. If you live locally, maybe we're having you come in once a month, okay? So we educate you on what it is that you can do to change your situation, have time on your side, all these things we talk about on the podcast. But over the years, Novera Headache Center, this is the 5th year we've been in business. I want to talk about all the different types of people we've seen, all the different types of diagnoses we've seen, and some of them felt impossible. So we've got a lot of people that have traveled to the Diamond Headache Clinic and Johns Hopkins and Mayo Clinic, these top-notch institutions to try to find relief, but they just haven't found the relief they're looking for. So we've had success with diagnoses, anything from tension headaches. Obviously, the traditional migraine diagnosis is most commonly what we're working with. We've effectively treated people that are presenting with cluster headaches, trigeminal neuralgia, occipital neuralgia, migraine with aura, migraine without aura, atypical migraine, meaning you don't even have head pain, you just have all these other symptoms that come with a migraine presentation. Even sort of one-off diagnoses like trigeminal autonomic cephalgias, chronic daily headache, which is a really, really tough one. Chronic daily headache is, it is debilitating, and it's one that, especially in the medical world, it's challenging. And not to say it's easy with our process, it's definitely not easy, but it's one we've had success with, all right? So what is happening here? All these different types of diagnoses can be helped by a physical therapist. Like, that's crazy, right? So let me bring this down to earth for you guys. Like, let me put it in like bite-sized pieces so you understand why I say that and how I got to this point of being very confident with just about anyone that has any type of head or facial pain, all right? So the first thing that we have to understand is that most people are in this perception or in this understanding that their diagnosis is attached to something objective, something physical, something that research has backed and says, like, you receive this diagnosis and it is solid. You can take that to the bank, and that means that your diagnosis is going to help you find the solution that you're looking for, all right? Now, I'm going to speak specifically to the headache and migraine category of all these different diagnoses. So like I just stated, we've seen all different types of headaches and migraines. All those people we've treated with a somewhat similar process, meaning we're applying pressures and we're educating and we're basically restoring function to the musculoskeletal system. Meaning we want your neck to move, we want your shoulders to function properly, and we want there to be stability. And we want each individual segment of your neck and shoulders and your jaw to function the way it should. Okay, that's basically it. Now, there's different ways that we do that, and we have a lot of experience because we only treat people that have headaches and migraines and symptoms associated with the neck. That could be dizziness, jaw pain, things like that. But because of that, we've gotten very good at understanding what people need. But as we boil it down, it's as simple as saying we want you to move better, okay? So applying movement, restoring function. That's essentially what we're doing. Now, when it comes to different diagnoses, it's applied to all those different types. So what's happening there? How does someone with a tension headache find benefit from the same treatment that someone with occipital neuralgia has, okay? Or someone with a very typical migraine, meaning all the classifications of a migraine are there, but how does that person respond and benefit from the same treatment that someone with chronic daily headache benefits from, all right? So what's happening there? So we have to understand that if we're holding on to that diagnosis and we're saying that this diagnosis will help me, there's a little bit of danger. Might sound like a strong word, but it might not be as helpful as we're assuming, because there's nothing objective behind that diagnosis. It's a diagnosis based on symptoms. So whatever symptoms you present to the physician, they will sort of say it back to you in medical terminology, in a sense. So, for example, trigeminal neuralgia is basically just saying that your trigeminal nerve pathway, like that pattern of pain, the three branches that receive sensation and send that sensory input to your brain, one of those is presenting with pain, so neuralgia. It's a nerve type pain. It's coming from the trigeminal nerve. And so we're going to give you the diagnosis of trigeminal neuralgia. Okay? So to receive the diagnosis of trigeminal neuralgia, they don't necessarily look at inflammation around a nerve. That's not necessarily what they're using. They're not like indicating that you have a heightened level of inflammation in that specific nerve. It's not necessarily taking that as objectively, this is what's happening in your body. Oftentimes they're just looking for pain patterns and then fitting that into classification system of different diagnoses. Okay, so, and not to say that that's not helpful at all, but what it does is it ultimately just leads you down the road of medication. In our Western healthcare system, all roads kind of lead to the pharmaceuticals, especially when we're talking about headaches and migraines. So the first aspect of this, of how I get to that conclusion, is that you can't necessarily trust your diagnosis will lead you to a solution, okay? So if we go into that with that understanding, meaning like, I'm not going to trust that because I have this migraine diagnosis and because the diagnosis of migraine, when I look it up online, is just a spontaneous neurological event, I'm not going to trust that I just have a neurological problem and that my musculoskeletal system is fine. Okay, that's what I'm talking about. If you were to take that diagnosis and trust that that was accurate 100%, then you wouldn't look at your neck at all. There'd be no reason to, because that diagnosis would lead you down the path of pharmaceuticals, which would then manipulate whether it's serotonin levels or something that is involved in the pain pathway so that you don't feel that pain, because all it is a spontaneous neurological event. Okay, do you understand what I'm getting at here? Okay, so diagnosis it's not without value, but it can lead you down this assumption of, oh, my neck is fine, this can't be coming from my neck, which is not what we want. All right. The second thing, so headaches have many triggers. Now, oftentimes people will have, and I would say almost always, your experience will be different than the person that you talk to, anyone else that has headaches or migraines, okay? So even someone that has the same migraine diagnosis isn't necessarily going to present with the same triggers, the same frequency, the same pain pattern as the next person that has the migraine diagnosis, all right? So there's so many different triggers, all right? So what we have to ask ourselves is, what is actually causing the pain itself, all right? So there's a lot of things that will impact your experience, but what is causing the pain? So if we're asking that question, what causes the pain, then we have to say, okay, well, if dehydration is impacting it, is everyone that gets headaches, are they always dehydrated when they get headaches? No, I don't think so. Like, it does happen, but there's a lot of people that aren't dehydrated when they get their headache or migraine. So do they all have gut problems? No, not necessarily. They don't all have gut problems. A lot of them do, and working on your GI system and gut health is very important. But it's not as if everyone that has a headache or migraine will have gut problems. The other question is, are their hormones out of balance? Is everyone that's presenting with head pain or facial pain or a migraine, are their hormones out of balance? No, I mean, it's definitely something to look at and something we want to consider, but that's not the common denominator. And then, do they have high levels of stress? Stress is a huge trigger for people. And that's something that people oftentimes will say, well, it's caused by stress. I wouldn't say it's caused by stress. The pain itself isn't caused by stress. A lot of people have stress in their life that don't have headaches or migraines. So what is actually causing the pain itself? All right, we have to separate that of the actual cause with what would be known as triggers. All right, so triggers are going to change the environment that we feel this pain in. And so this is in large part where Novera has been on this journey to understand what is causing pain. What's the common denominator between these people that are all dealing with head and facial pain? And I can say with a high level of confidence, after the hundreds of people that we've seen here at Novera and the different types of diagnoses that we've worked with, that the common denominator is that their musculoskeletal system isn't functioning the way it should. It's not functioning efficiently, and there's tension in that system, meaning your neck is tight, your neck is sending a pain signal, your shoulders, your jaw, something within your physical body, so muscles, tendons, ligaments, the joints themselves, so bones interacting with other bones. There's something that's not functioning quite right, and that is causing a pain signal. How you experience that pain signal is impacted by those triggers. But if we separate these two things and say triggers are things that impact my experience, but the actual source of pain itself is likely something physical, that's a safe statement based on everything we're seeing here at Novera and the different types of diagnoses that we've worked with. And so we get out of this mindset of because stress impacts your situation, because hormones impact your situation, or because barometric pressure changes or your dietary changes impact your situation, we can't necessarily attach the word cause to that, because it definitely impacts what you're feeling, and it's something to pay attention to. Of course, that's why we have all these other providers on this podcast. That's why we want to be holistic in how we think. But as far as where the actual pain's coming from that's causing you to have this, we can almost always trace that back to the musculoskeletal system. Okay, I hope that makes sense for all of you listening. As far as the third step of how I got to making that statement of anyone with head or facial pain should be evaluated by a physical therapist because there's a high chance you have neck, shoulder, jaw problems. So the third step that got me there is that you should, and this is where we've gotten to after years of practice, is you should assume pain in the head means a neck problem. All right, so the intensity of headache and migraine symptoms, the debilitating impact that it has on people's lives, it can definitely cause concern and anxiety and the sense of something is really wrong with me, okay? And so but what I want you to know is that our healthcare system is very good at catching the things that are going to be life-threatening, okay? I'll say that again. Our healthcare system is very good at catching the things that are going to be life-threatening. So, and I believe it's almost to a fault, meaning the focus is so heavily on the tumors, the brain bleeds, the different types of stroke, the things that may cause headaches, but that are actually life-threatening. They screen for those. They perform images to check for those things, but the likelihood is so low that it's generally not a concern. I took this quote straight from Johns Hopkins' website. They state, in most cases, x-rays, CAT scans, and other diagnostic tests are neither necessary or even advisable, since they say very little about what's causing a headache, all right? So when it comes to that feeling of worry of what might be wrong for me, one, I want to speak to that as an innate, you know your body and you know what you need, and I don't want to discourage you. If you feel like you really need help, and you want to get that screening done, by all means, go do it, because especially on a podcast, I don't want you to listen to a guy on a podcast and or actually have something really wrong with you and me to discourage you, what you innately feel, to not do that. And even if someone in our practice is feeling that way, I mean, I want to encourage them however I can and evaluate them and make sure that our plan of care is appropriate. But just know that our healthcare system, if you've gone to a primary care doc, neurologist, they're really good at screening for the things that are life-threatening. And so what happens after that is usually where it'll fall short. And so if we don't find the things that are life-threatening, I mean, my experience with going to the emergency room, like if you're not dying, then it's not super helpful. And I'm not talking specifically about headaches or migraines because I've never gone personally for those reasons. But if you want to just improve your quality of life and they can't find anything that's killing you, they can't really answer that question. And I think that's sort of a micro example of our healthcare system as a whole, where if you really want to feel healthy and work on wellness and improving quality of life, I don't believe it's catered to that. All right. So if you're asking those questions and you're not getting them, that's because I don't believe our healthcare system's set up to do that. And so bringing this back to the third point, which is assuming pain in the head means a neck problem, the majority of people that are dealing, especially with years of head and facial pain, are most likely dealing with a neck problem. And that's because the neck refers pain into the head. There's a study where they injected an irritant into the suboccipital area, so the top part of the neck, base of the skull. And what it did, it was interesting, it sent pain into the face, into the head, into the temple. These different referral patterns popped up. And so there's good evidence that we know if there's an irritated upper neck, that presents as head pain, all right? So it's almost as if someone having knee pain, we would assume there's something wrong with the knee, okay? So there can be different types of knee pain. There can be different tissues within the knee that are irritated, and there can be different things that impact the knee. So for example, and this, I think this is probably one of the most helpful examples, but if you have knee pain or you've injured your knee, you have a meniscal tear, you've had osteoarthritis in your knee, maybe you've had a knee replacement, something like that. Generally, those people are going to be sensitive to barometric pressure changes, all right? So would that person say like, oh, my knee pain is caused by pressure changes? Well, they might say that, but I think a more appropriate term is your knee pain is impacted by pressure changes, but the pain itself is caused by whether it's the arthritic changes or the inflammation from an injury or the meniscal tear that's disrupting the mechanics of your knee joint, okay? So if we correct those things, then the barometric pressure, so if we reduce the inflammation in the knee, the barometric pressure doesn't impact it as much. So everyone's experiencing the same pressure change, but the person with the knee problem has the knee pain, which means we need to understand what's going on with the knee itself. So just to be clear on my example here, what I'm talking about is head pain is so closely connected to the neck that if you have head pain, we should think neck. All right, so we should evaluate the neck. We should try to understand the neck, especially because our healthcare system does such a good job screening for the other stuff. Well, let's figure out what's going on with your neck and shoulders and jaw now. Now, if your neck, shoulders, and jaw present with an issue, the chances of you going through a proper evaluation and something popping up as far as a neck inflammation, irritation in the neck or shoulders, it's very high because of that close association. All right. Again, with the knee, the hip can refer pain into the knee. All right. And so there are secondary things that could lead to knee pain, but if we hear hooves, let's think horse, let's not think zebra, all right? And so in our mind, the head facial pain presentation is almost always going to be neck, shoulder, jaw, all right? And then as far as evaluating that and treating it, it's gonna look different, slightly different for every patient. But ultimately, like I said initially, we just want to get things moving better. All right, it's that simple. We need to restore the body to how it wants to function, how it should normally function. All right, so the third case is if you have head or facial pain, the neck refers pain into the head, and we should assume the neck is involved to some extent. All right, so just to recap here, we're asking the question, who is this actually for? All right, so you're talking to a friend, you're talking to your neighbor. You've gone through our treatment process and you're like, I don't know if I should recommend this. Like, this person's situation sounds different than mine. Ask the question, do they have head or facial pain? Are they dizzy? Do they have jaw pain? Jaw popping, clicking? So if their diagnosis is something that you haven't heard of, if their diagnosis is something I didn't necessarily list here, but they have head or facial pain and they're not finding the results they're looking for, that would qualify them to say, hey, you should at least get your neck looked at. Now, if that's by us, great. If it's by a physical therapist in their area, hopefully it's a good one that can really evaluate it properly. But we need to start thinking a little bit differently about this scenario. Again, just to recap, how we got here is maybe we've relied too heavily on our diagnosis that has communicated to us that your neck could not be an issue at all right? And it's led you down the road of medication and the pharmaceuticals. The second thing is that we've assumed these triggers are causing your symptoms, all right? But they're just impacting your situation. They're not causing the pain itself, just like the knee pain's not being caused by the barometric pressure change. The knee pain is there. It's underlying the inflammation, the irritation of the knee was there. It's just impacted by the barometric pressure changes. And then third, understanding and knowing that the head and facial pain is a referral pattern from the neck. And the neck is the most likely source of head and facial pain. And so let's start thinking that way. And then knowing that our Western healthcare system is good at catching the things that are going to be life-threatening and really scary. So let's start improving people's quality of life by evaluating the neck, understanding how to manage triggers, and really that department is just being healthy. That's why I want people to go see these functional medicine providers that I work with, or naturopathic providers, or breathing and airway specialists. We want people moving better, eating better, living healthier lives, and having a better quality of life, because that's going to help in general, and especially with the triggers department. And then third is understanding that your neck can refer pain into the head or the face, and that pattern can look different from person to person, but be validated in understanding like you don't actually even have to have neck pain. A lot of people we work with, it's just in their head, okay? So you don't have to intuitively think, oh, my neck hurts. Most people we work with have that intuition, and that's probably part of the reason you're listening to this podcast is you've always thought my neck was a problem, and now you're listening to me validate that. So hopefully that's encouraging. If you have questions about this, if you want further insight or understanding, then please reach out to us. This is a podcast that I'm a physical therapist. I'm unashamed of that. And I love being a physical therapist because it means I get to help people move better, live better lives, and be healthier in how they function. And it just so happens that it's really useful when someone has head or facial pain. My intent is to empower and educate and encourage everyone with headaches and migraines. So what that means is I know that oftentimes what we talk about on this podcast is very, very different from what you've heard. The journey to find headache and migraine relief can be fatiguing and tiring. And so by no means do I want to oversimplify that. I do not want to sound like someone who cannot empathize. And I want you to understand that I understand the impact that this can have on your life. I've seen it over and over again on these people that we get to work with, and so I don't want to minimize that at all. That's what I'm saying. but I want to empower you. So I don't want you to leave here feeling agitated, like, oh, this guy just thinks it's all in my neck. I want you to leave here feeling empowered of like, okay, this is something to explore. This is something that I can look into. And take baby steps. And I want to help you take baby steps. And the first thing you can do is just subscribe to this podcast. I talk about the neck probably once every three or four podcasts. So it's definitely not every podcast, but it is important. So it'll definitely come up again. And we'll keep having good guests in other specialties on this podcast. And as always, please leave a review, a 5-star review. If this podcast doesn't sound like it's what you're looking for, then please go listen to a different podcast. We are for people that are really looking to address an underlying issue in their headaches and migraines. And so if you're looking for pharmaceuticals, if you're looking for medication, I'm sure there's another podcast out there for you. It's just not going to be this one. Because as always, it's our mission to educate and empower everyone with headaches and migraines so you can break free from a life of fear of your next headache or migraine and dependence on medication, allowing you to thrive in everything you do. Thanks for listening.